I'm Rehman. I'm a consultant trauma and orthopaedic surgeon. I'm going to talk to you about hip replacement surgery, what it is, who qualifies for it, and some of the specific risks and benefits. Hip replacement involves removing damaged bone and cartilage from a hip joint and replacing it with prosthetic implants. The operation is done for patients with severe hip pain and mobility issues that haven't improved, with treatments like physical therapy and medications. Some of the conditions that can cause hip pain like this include osteoarthritis, which is the most common by far. That's described as wear and tear of the hip bone and cartilage. There's also rheumatoid arthritis, which is inflammation of a hip joint, inflammation that can result in destruction of a hip joint. Rheumatoid arthritis can affect multiple joints, in fact, as can osteoarthritis. Post-traumatic arthritis, which is wear and tear in the hip joint after severe trauma to the hip joint. Avascular necrosis of a hip joint, which is where the blood supply to the hip joint is compromised, leading to bone damage. And then the last big category, I guess, that's worth talking about is hip fractures, which typically affect our older adults. And this pain I'm talking about has to be really severe. And we're talking about the type of pain that affects every activity of your daily life, including things like washing, drying, dressing, getting about the shops. Pain that persists during rest, so pain that you might experience sitting down to have dinner with your loved ones, or pain that even you experience while sleeping. And when you have this level of disability, that's when hip replacement comes into play. The hip joint is a ball and socket joint. The operation starts by putting an incision over the hip, removing damaged cartilage and bone and replacing it with a prosthetic ball and prosthetic socket. Done right for the right reasons, it's one of the wonder cures of the 20th and 21st century. Hip replacement boasts some of the highest success rates of all surgeries of all time. That being said, there are some infrequent risks that can be very serious that you have to be aware of before you sign up, and we'll go through those now. Infection can affect between 1 and 2% of all hip replacements. Now, we take every precaution available to us to prevent you from getting an infection. You'll get preventative antibiotics, we have clean airflow, we use sterile drapes, gloves, gowns, masks, the full works. But there's a small group of patients that will still get unlucky, and that's because the bugs can get to the hip in a number of ways. In the worst case scenarios, this can require redo surgery. Damage to blood vessels and nerves is extremely rare during a hip replacement. Now, nerves are very, very delicate, and you only really have to look at them the wrong way for them to go off to sleep. Should that happen, it can affect the feeling in your foot and the movements at the foot. That can persist for months, even up to years. In the most severe cases, nerve damage can cause permanent problems. Blood loss. Blood loss during hip replacement is very low and not really a problem at all. However, if you do lose a bit more blood than we anticipate, it can put strain on the heart, and that can cause a heart attack. On the brain, that's a stroke. Now, we do check your blood count after a hip replacement, and if your blood count has dropped sufficiently to cause you problems, we will offer you a blood transfusion. The main risk of a blood transfusion is an allergic reaction to the new blood. We manage this risk by matching your blood type. Blood clots can be a big deal. The reason a blood clot can be troublesome is that if it can move from the leg into the lung, then it can be life-threatening. Now, to minimise this risk, we'll give you a blood thinner after the operation. You can help us further and help yourself further by getting up and getting moving early on. That gets the blood circulating, very similar to what you would do on a long-haul flight. Modern implants are extremely durable with lifespans of 20-25 years upwards. However, in some cases, they can wear out or debond from the bone a bit earlier, meaning redo surgery a little bit earlier. For most patients, one hip replacement for that one hip joint is usually sufficient for the rest of their life. Instability is a risk whereby the new prosthetic ball can jump out of the prosthetic socket. I have to say, we do check that the hip is stable on the operating table before we finish up, so this is quite a low risk. But if it did happen, it can again mean redo surgery. There's also other factors to consider with respect to stability in the hip as time goes on. Fracture. If you have a bad tumble after a hip replacement, you can break the bones around the new hip. I live in Scotland, so we have the ice to contend with during the winters as well. The significance is that it can mean redo surgery. The hip can actually break during the surgery itself, but if it broke on the table, we'd obviously fix it there and then. If it broke outside the hospital, you'd have to come back to us. Stiffness after a hip replacement is very rare. The key in preventing this is just to do the exercises that the physios demonstrate to you. If you start doing the exercises before the operation, you'll enhance your recovery and rehabilitation. Dissatisfaction after hip replacement, rare. Leg length discrepancy. People worry a lot about leg length discrepancy. I think it's important to start by saying nobody is perfectly even in their natural state. As your surgeons, we sometimes add a tiny bit of length to your hip. There's a number of reasons we might do this. We might be trying to get you back to where nature had you before the arthritis set in, or sometimes we have to do this to get the hip stable. What I'll say is that the amount that's added on is so small that the body will not notice it. Residual pain or new pain after a hip replacement is extremely rare. What I'll say about this is hip replacement surgery for problems arising from the hip joint is very effective, but it's not going to cure problems related to spinal arthritis or nerve-related pain. If you have those coexisting or pre-existing, that might be a cause for problems afterwards. Severe complications resulting in loss of limb or death after hip replacement surgery are extremely rare. I hope this video has been informative and I haven't terrified the life out of you. I'll just restate that hip replacement is highly effective. For the majority of patients, it really does transform their lives. For the majority of my patients, it's been the best decision they've ever made. If you're considering hip replacement surgery or you're waiting to have it done with me, I wish you all of the best on your journey to recovery.